Take a look at this strange facial massage that is being performed inside of a person's mouth. Esthetician Dana Omari performs what she calls the Buccal massage. This is in her Manhattan practice, and this is a real treatment. Apparently, Megan Markle has had this done. So my question is there anything to back this up? Because this is a before and after picture of Dana's treatment on her client. It looks good. It seems relaxing. I want to sign up, but does it actually do anything?
So this is really interesting because my instinct as a dermatologist was actually to outright dismiss this, that it was just, oh, it probably feels good, it improves circulation.
Facial yoga.
Yeah, and so it's basically just a temporary stimulation that adds a little bit more circulation and glow. But this is fascinating. When I took a deep dive into this and I looked into the research, there's actually some very good science behind this. And so Dr. Ordon and I were talking before this segment about the Buccal fat pad and how this fullness in your cheek is a sign of youth. And when we talk about facial aging, we talk about the skin developing wrinkles and brown spots, but we in plastic surgery, dermatology, are always talking about how as we age, we also lose that substructure volume. We all lose fat, we lose muscle. As we get older, our muscles thin and weaken. And so this is really building on the idea that if you exercise and you tone the muscles of your face, that they will become stronger and more toned, and that will actually restore some of your facial volume. And so it's fascinating because when you see something like this massage online, the idea is that you're going into the mouth and it's fairly firm. You don't want to hurt yourself, but you do want to feel a little bit of pressure here. And so the ideas are when you watch these different people like Nicola Joss or the facialist we saw, they're always talking about really going firmly, sweeping along this jawline, going in the mouth, doing a deep massage. And you want to do this under the cheekbones. Yeah. So the idea is you're going right under here. And it actually, when I read about this, I was fairly intrigued because it feels pretty good. We're all grimacing throughout the day. We're very tense. We're squinting. And when you do kind of a firm massage, and you're especially using your good products with your serum and your anti-aging agents, you're actually spending the time to work them in your skin. There's some really nice short-term circulation.
I think it's a huge stress reliever. I mean, we know all that stress that we hold in that temporal mandibular joint, and when you get in there inside the mouth and you're massaging that buccal space, you're working on those muscles, the muscles, chewing muscles, muscle mastication to fix on that joint. What I see in that picture is that this is really a great lymphatic massage or venous return, and we know we all retain fluid in our faces, especially under the eyes. I think you would see a change, that you would mobilize some of this retained fluid in the face to just give a more sharp look to the face.
Yeah. And there was a really fascinating study that came out of Northwestern University just this month, so really recently, and they actually did a controlled study where women did between the ages of 40 and 65 30 minutes of exercise 5 days a week, where they were trained by someone to do exercises just like you would do at the gym, but on the muscles of your face. They've monitored them in a very scientific way, and they actually had pictures of them before and after and had blinded observers say, how old do these people look? 5 months into this study, the people on average were said to look about 3 years younger. They actually had increased upper and lower cheek volume. And so just like you exercise any muscles,
all right, guys, show me a move. Show me a move. What can I do?
This is a device. Oh, so there are a couple things. This is a device you can use. It's called the Refa. It actually has a microcurrent. So that's kind of cheating a little, just like you would for exercise and doing a micro circuit or a micro stimulation here with microcurrent. But the exercises you can do are exactly what they sound like. Don't hurt yourself, but you can go online, you can see some tutorials where you're stretching your neck and you're working on the platysma here, working on the jawline. You could do things where you puff out your cheeks and hold it. You could do ones where you hold your tongue out. It sounds really ridiculous, but you hold it out for 30 seconds. Sounds very hokey. As a dermatologist, I was very quick to poo-poo this.
This is like Simon says. Sonia said, stick your tongue out. It's easier to smile than frown. So there.
Absolutely.
Well, this is interesting.